Good morning, everyone. On behalf of ProHealth Physicians, I would like to welcome Governor Ned Lamont and all the elected officials and administration officials also to Middlesex Practice. Governor, we are pleased to have you here today, and we are honored to host this event.
Could you identify yourself, please, sir, for the viewers?
Yes, I'm Dr. Benito Alvarez. I am the CEO of ProHealth Physicians. ProHealth Physicians was founded in 1997 out of a mission to deliver outstanding care to Connecticut's residents. Since then, we have grown to include 90 locations with over 400 providers who are honored to serve close to 380,000 patients. That's about 10% of Connecticut's population. While care has evolved over the last 23 years, ProHealth's commitment to our patients remains unchanged. In 2015, we became part of Optum, which is part of United Health Group, becoming part of an organization that, with 6,100 employees across Connecticut, is delivering innovative health services to 645,000 people in our state. Having such an extensive presence is both a privilege and a great responsibility. It is at the core of our commitment to work collaboratively towards a higher goal, which is beautifully summarized by our mission, which is to help people live healthier lives and help make the health system work better for everyone. Now, we are positioned better than ever to advance this mission, providing value-based care to the communities that we serve. This means doing right by the patient by delivering evidence-based quality care at the right time and place in an affordable way and with the best possible patient experience. We believe that when you put the patient first, you can't go wrong, be it clinical protocols or public initiatives. Ultimately, caring for people is what it's all about. Governor, we know that you share this commitment and appreciate your leadership on issues that affect every single person in this state. And I welcome you once again to our facility. Thank you. I would like to pass it on now to the Lieutenant Governor of the state of Connecticut, Susan, I want to say it right, Bysiewicz. Outstanding.
Awesome.
Nailed it.
Okay.
Thank you, ma'am.
Thank you so much,
You're
Dr.
welcome.
Alvarez. Good morning, everybody, and welcome to Middletown, my hometown. We are so happy that all of you are here. Connecticut has been a leader in healthcare. Connecticut is a state that has been recognized by many of those that benchmark access to health care is one of the best in the country, and we're very proud today to announce that we are continuing to innovate because of the vision of our governor and our healthcare commissioners. We are very committed to improving affordability of health care for everyone in our state through these two executive orders that the governor is going to sign in a few minutes. We have a number of speakers here who are going to talk about how this will help to improve not just cost, but quality, equity, and accessibility of health care across our state. So with that, it is my great pleasure to introduce the Executive Director of the Office of Healthcare Strategy, Vicki Veltri. But before she steps up to the podium, I'm just going to brag on her a little bit because she has already put forward some initiatives to help increase transparency and to help the consumers of healthcare in our state choose the highest quality and most cost-effective healthcare. So it's my great pleasure to introduce Vicki Veltri.
Thank you very much. We're going to have to make a mic adjustment there. Mark, can you take care of that?
Yes.
A stool.
Yes, so that we can see her.
Could that be
It probably
her
won't be-
height?
Yeah, it probably won't be growing anytime soon.
Is that better?
Thank you very much.
Yeah, even a little bit more if you can, just point
Okay.
them down, point them down.
Yeah, that'll be fine.
Thanks, Joe.
Thank you very much.
All right.
I want to thank Governor Lamont, Lieutenant Governor Bysiewicz, Dr. Alvarez, and all the supporters who are here today. As the Lieutenant Governor said, the Governor will be signing 2 executive orders today. I'm going to talk about Executive Order number 5, which will be signed, which sets the stage for Connecticut's first healthcare cost growth and quality benchmarks and a primary care spending target. You know, annual healthcare cost growth benchmarks are the key to reining in healthcare spending. Essentially, benchmarks set a rate of growth for healthcare spending so costs don't continue to go unchecked. In Connecticut, over the last 15 years, healthcare costs have grown 77%, while in that same time frame, wages have only grown by 21%. If that rate of growth carried through to grocery items, a dozen eggs would cost $100. A pound of coffee, for all of you in the room, would cost nearly $82. Healthcare prices continue to climb while utilization is relatively flat. That is unsustainable for everyone in Connecticut, for individuals, for families, for the business community, and the state itself. Because of these increasing costs, the average family in an average year spends the same amount of money on their health insurance coverage as the cost of a compact car. Using regulatory tools such as Certificate of Need, OHS, the Office of Health Strategy, has been able to impact healthcare cost growth in some transactions, but this tool is not available to us across the entire healthcare landscape. So Executive Order Number 5 takes a broader approach by establishing these statewide annual healthcare cost growth benchmarks that apply to healthcare entities. So that includes providers, payers, public and private, and lets us get at the actual cost of healthcare treatment that's provided, including pharmaceutical spending and other costs. And we can also check on the appropriateness of spending, and our ability will be enhanced to target initiatives to improve health and eliminate serious health disparities in our state, particularly for people of color. You might say, has anybody else done this? Well, interestingly enough, over 5 years, since Massachusetts enacted its healthcare cost growth benchmark, it saved $5.5 billion over the national healthcare spending rate. Massachusetts also saved approximately 9.5% on its state employee costs because of the lower rate of healthcare cost growth in its spending. As important as cost containment is, we also need to focus on better healthcare quality. And that means addressing not only clinical quality services, but whether people are getting the right care to keep them healthy and safe and have better healthcare outcomes. Finally, investing in primary care and the services that coordinate care and head off higher cost services by finding and treating problems before they become major conditions is absolutely critical. This executive order helps us reprioritize healthcare spending by setting a primary care target so that by 2025, primary care spending reaches 10% of all total healthcare expenditures. This is going to be a collaborative process. We will work with technical experts across our healthcare landscape to solve the major issue facing residents and employers, which is the underlying costs and drivers of healthcare. Again, I want to thank Governor Lamont and Lieutenant Governor Bysiewicz for their commitment to bringing healthcare costs under control. This is an important step forward for the state, and I'll turn it back to the Lieutenant Governor.
Thank you very much, Vicki. And now we're going to hear from our Commissioner of the Department of Social Services, Deidre Gifford. Commissioner. Thank you. Do you want to?
You can leave them like that.
Okay.
Yeah, they should see
Good morning. Thank you, Lieutenant Governor Bysiewicz. Thank you, Governor Lamont, Dr. Alvarez, and all of the team here at ProHealth Physicians. I'm delighted to be here. And thank you to my colleague, Director Veltri. In addition to the executive order that Director Veltri just described today, Governor Lamont will also sign Executive Order Number 6. This order directs the Department of Social Services, DSS, to develop a public transparency strategy for Medicaid cost and quality, and report to him on that strategy 1 year from now. To develop the strategy, the executive order also directs DSS to convene an advisory board of stakeholders, including our members, state agencies, and experts in quality measurement and reporting. And further, the order directs DSS to employ this measurement and transparency strategy as the basis for future strategic interventions to improve cost and quality and reduce health disparities in the Medicaid program. Why is this executive order significant? Connecticut Medicaid and Children's Health Insurance Program, together known as HUSKY in Connecticut, provide comprehensive health coverage to almost 850,000 residents of Connecticut. While just under 60% of these costs are covered by federal dollars, the state costs comprise over 20% of our annual state budget. Furthermore, Husky provides coverage and services to some of the state's most complex and medically vulnerable individuals, such as children with special health care needs, persons with disabilities, and older adults. And we often provide coverage and benefits that neither Medicare nor commercial insurance offer. This care is absolutely vital, and it's also costly. Connecticut can be justifiably proud of our Husky program. As a former federal Medicaid official, I can tell you that from both the federal and the state level of government. But what this all means is that at DSS, we have a responsibility to ensure that the care in Husky is the highest quality and the most efficient that it can be. Today, Governor Lamont is directing us to take a very big step in that direction by developing and making public by the end of the year a comprehensive set of measures by which Husky healthcare quality and efficiency can be measured and, importantly, followed over time. We thank the governor for his leadership and direction on this issue. I want to make clear that under the leadership of our longtime state Medicaid director, Kate McAvoy, Connecticut DSS already does a good job of sharing data and keeping the public informed. We annually report 19 measures on quality for children and 25 for adults, and our quality measures are contained in the CMS Medicaid scorecard. We also share cost, enrollment, and eligibility data with our colleagues on the legislative side, on the Human Services and Medical Assistance Program Oversight Committees. And I want to thank Representative Abercrombie, Senator Abrams, Senator Moore, and all of our legislative colleagues and members of the Human Services Committee for their diligence and partnership in oversight of the Husky program. But under this executive order, DSS will take that transparency to the next level by establishing the advisory board and developing quality measures and reports, as well as with other members of our sister state agencies. The providers here will tell you that quality measurement is never easy, and they will also tell you that they feel they're burdened by too many quality measures. And they're nodding. And that we sometimes measure the wrong things. And Director Veltri and I have committed to take that issue head on and work with our provider partners to make sure that the quality measures that we are working on in these two programs are important and efficient. So again, I want to thank the Lieutenant Governor and the Governor. Thank you.
Thank you so much, Commissioner. And before I call on the next speaker, I'm going to ask Mayor Ben Florsheim to pick your way through here, because I know it's a bit of a maze. But Mayor, we appreciate your leadership in Middletown, and thank you so much for joining us today. And now I'd like to bring forward Senator Matt Lesser, someone who not only represents Middletown, but he's been a leader both in insurance and health care for our state. Senator Lesser.
Thank you so much, Lieutenant Governor Bysiewicz. Thank you for your leadership. And thank you, Governor Lamont, for being here today and for signing these two really important executive orders. First of all, welcome back to Middletown. I think this is, though, the first time I've ever welcomed you to my doctor's office. This is a little bit of a surreal experience, but it is good to see my doctor, Dr. Hirsch, over there, as well as the great team right here at ProHealth Physicians in Middletown. The executive order I want to focus on today, Executive Order number 5, is something that came out of the healthcare negotiations we talked about last year. It's something that we funded in the state budget and wouldn't be possible without the leadership of an extraordinary individual, Vicki Veltri, who is leading our Office of Health Strategy. Talk a little bit about how this came into being. You know, last year, the governor, working with Representative Scanlon and myself and Senator Kelly, put forward an incredibly bold idea, the idea that we should lower the cost of health insurance, of health care, by 20% for families and small businesses. And by articulating that message and focusing on that goal, the question is, what can we do about the growing cost of health care? Other governors in the past have been afraid of taking on this issue, but as a small business person, I think Governor Lamont really gets it and understands that if healthcare costs keep growing faster than the cost of inflation, that is going to impact the entire economy overall. It's going to prohibit the economy from growing, and as Commissioner Gifford just pointed out, it also eats up the state budget as well. So the importance of setting a cost growth benchmark really can't be overstated. That's the way we're going to control costs over the long run. And it's something that works. We know that because just to our north, the Commonwealth of Massachusetts has this in place. They have a health policy commission. And in this fall, I went up to see how it works. I went up and they have a hearing. They have all of the stakeholders. They've got doctors, they've got payers, they've got hospitals, they've got pharmaceutical companies all sitting at a table having to explain why costs are going up. They have the data where costs are growing, and they talk to each other and figure out where there's waste, where there's duplication, where there's unnecessary cost growth, and it's worked. By having those conversations, they've been able to keep cost growth down. That's money that will all come into our economy, that benefits their economy, and it should benefit our economy. So we came together as a legislature to fund this initiative. We put the funding in the budget, and I'm thrilled that under Governor Lamont's leadership, we are now providing that direction to the Office of Health Strategy to make it go forward. I'll shut up now, but I want to just talk about why it is so important to focus on things that do work. Because one thing we know that does work, that does save costs, is preventative care, and that's the kind of care you get in places like ProHealth Physicians right here in Middletown. This is not a theoretical concept for me. I was here for a regular checkup when I was 29 years old, and I came in because my health insurance required me to come in for a checkup, and I reported a couple of symptoms to Dr. Hirsch. He referred me to a specialist. Turned out I had stage 2A cancer, and if we hadn't caught it, which meant that we caught it just as it was beginning to spread. That saved money for me. It also might have saved my life. But that is the kind of work that is done every day in primary care practices all across Connecticut. It is cost effective. It makes sense. And by having a conversation, by bringing the data out and showing where stakeholders can really save costs, we're going to really make a difference in the overall growth of and cost of healthcare. Thank you.
Senator Lesser, thank you so much. So, making sure that health care is affordable, accessible, and cost-effective is a bipartisan issue, and we're happy to be joined by Senator Kelly, who is the ranking member of our Insurance and Real Estate Committee. Senator Kelly.
Thank you, Lieutenant Governor Bysiewicz, and good morning. Connecticut residents deserve affordable, accessible, and quality health care. But for far too long, families have struggled with the high costs of premium and medical bills, and worse, some have even delayed or did without the needed care that they deserve. What this does today is it takes and moves our state in a positive and forward motion to start to look at ways in which we can increase transparency and get our arms around the increasing costs of Medicaid so that medical costs, so that we can bring the relief to Connecticut families. To that end, I'd like to thank my colleagues on the Insurance and Real Estate Committee, both Senator Lesser and Representative Scanlon, as well as Representative Pavelak D'Amato. But I'd also like to applaud the governor's efforts and work to advance these initiatives with the executive orders this morning so that Connecticut can get a jump start on bringing this relief to Connecticut families. Thank you.
Thank you, Senator. And now I'd like to introduce Representative Sean Scanlon, who chairs the Insurance and Real Estate Committee and Public Health Committee in our state legislature.
Thank you, and good morning, everybody. Connecticut residents and families and small businesses, they are fed up with the high cost of health care. And today, thanks to the work of Governor Lamont, we are doing something to dramatically rein in those costs and really give those individuals the confidence that Connecticut government understands the problem and are actively working on the solution. As Senator Kelly just referenced, we try to do a lot of things on a bipartisan basis. And if you look at what's happening on the news today, you don't see a lot of that anymore. But we are truly doing that in Connecticut each and every day on the Insurance Committee and trying to work with our partners, whether it's the governor, the lieutenant governor, or the administration, to come up with the solutions. There's no one silver bullet solution to lowering the cost of health care in Connecticut, but we are taking an effect every single day to try to chip away at the costs that we know are driving anxieties in the state every single day from people who are worried about this and sitting around a kitchen table looking at the bills piling up, and they're looking at the cost of their insurance going up and up while that insurance covers less and less. And we are committed to doing that, and I want to applaud the governor for his leadership. He has been a true leader on health care since coming into office last year, and he has been a true partner to Matt, myself, and to Kevin as we try to tackle these costs on behalf of our constituents. They're not just Democrats, they're not Republicans, they're people in the state of Connecticut. They want us to get this done, and they don't care who does it or who gets the credit. They just want to see progress and lower costs, and we're working on that every day. Thank you, Governor, for what you're doing. We really appreciate it.
And now it's my pleasure to introduce the CEO and President of the Connecticut Health Foundation, Pat Baker.
Thank you, Lieutenant Governor. Good morning. The Connecticut Health Foundation's mission is dedicated to the elimination of racial and ethnic health disparities. And we're here to applaud this important critical step in addressing Connecticut residents' universal concerns regarding the cost of health care and the quality of health care. Now, while Connecticut may rank 6th in national rankings, that is not the case for people of color in Connecticut. In fact, we rank 23rd in the nation for outcomes for people of color. The reality is that for a baby born to a black mother in Connecticut, they're 4 times more likely to die before their first birthday than a baby born to a white mother. Health disparities have huge, deep human consequences, whether it's poor health, lost limbs, or shorter lives. And it has economic costs to society with higher health care spending. In 2018, there was a study in Connecticut that linked disparities to an estimated $384 million in excess hospital costs for black residents and $121 million for Hispanic residents. This order recognizes the need for robust data, including race and ethnicity, accountability for quality and outcomes, and the cost growth, coupled with the commitment to quality benchmarking and the investment in primary care, provides a strategy in which Connecticut can lead the nation in the health and well-being of all its residents. The Foundation stands ready to work with everyone at this podium and in our communities to make Connecticut the healthiest state and most equitable in the country. Thank you.
Thank you, Pat. And now it's my pleasure to introduce Paul Grady, who is the principal of the Alera Group and also a board member of the Connecticut Business Group on Health.
Thank you, everyone. Growing healthcare costs have been a tremendous burden to employers and employees, and it affects our ability to compete not only here in the United States but across the world. And there have been lots of initiatives to control costs, both private and public. What is different about this initiative, I think, is that it's a public-private partnership. And what I've seen is a lot of collaboration. If you look at what's happened in other states, there's a focus on working together to address the root causes, bringing transparency and accountability to the system. And we think that that's going to make a difference. So we applaud this initiative. We're excited about it, and looking forward to getting started.
Paul, thank you so much. Now it's my pleasure to introduce Governor Lamont.
Good morning, everybody. And ProHealth Physicians, thank you for inviting us to your home. Let me tell you what this means and why I think it's important, these two executive orders. As Susan said, Connecticut's been a leader in health care for a long time. We have one of the lowest rates of uninsured in the country, but we also have some of the highest health care costs in the country. And what that means to a middle-class family who's getting squeezed, as was pointed out, health care costs are going up at 3 or 4 times average wage increases, and that's unsupportable. What Deidre and Vicki said, how that impacts the state of Connecticut, not just those families, but also what it means in terms of our budget as a state. And those are costs that are going like this. And as Matt pointed out, look, I feel this every day as when I was leading a business. It's a cost. And as that cost is going up, what that does to small business, trying to do everything we can to provide good health insurance for all of our folks, and yet it's a fixed cost that goes up. So we've got to address the underlying costs of health care, and that's what this bill is all about. And one of the things that struck me as I've been getting more informed on this is the disparity of health care outcomes and price are all over the map compared to any other market that I have seen. And one of the things we're trying to do with these executive orders and then working with the legislature is shed some light on this, some transparency. So you'll be able to get a better idea of where you get the best value for the dollar, where you have lower costs, but also better outcomes, and what that means in terms of quality. And so we can do a better job of steering people to places where they get the highest quality return on their health care dollars. And that is just incredibly important in terms of what that means in terms of savings for the state and what that means in terms of individuals. And we're doing that. Kevin Lembo, our controller, working with the state employee plan right now, is already bringing all the data he has in terms of state employee costs and outcomes and shedding light on that and helping to steer people to centers of excellence where that makes a difference. Deirdre's trying to do that in terms of Medicaid. Vicki's trying to do that more broadly in terms of our health insurance plan going forward. But this growth benchmark, this cost growth benchmark, gives us the insights and intelligence we need to be able to better negotiate prices, be able to better steer people to places of excellence where they get the very best health care, maybe right here at ProHealth, and what that means in terms of quality and what that means in terms of cost. And I'll just leave you. Connecticut, we are naturally suited to be a leader here. I mean, we have the best healthcare professionals in the world in Connecticut. We have some of the best hospitals in the world. We have health insurance companies here. We have lots of innovation going on in terms of healthcare up and down the state. This is a place where Connecticut is a leader. So shame on us if we cannot collaborate, work together, and show the rest of the country how we're able to get a control over these underlying costs and direct people towards the highest quality outcomes. That's what these executive orders are all about. That's why I'm proud to sign them today. And I thank each and every one of you for being here today.
So after the governor signs the 2 orders, then we'll take questions on this healthcare topic. Getting really good at this, Gov.
I'm getting the hang of it.
There you go. Excellent. Thank you so much, everybody. All right, so we're very happy that so many members of the media came today. Thank you for coming. Any questions on the executive order?
I wonder if Senator Lesser could elaborate, or anybody who knows as much about it. In Massachusetts, you referred to them having these annual meetings where the providers have to explain what stuff costs and why it costs, or whoever knows about it would be fine.
Yes, Massachusetts has an existing law that's been on the books since 2012. What they do every year is they develop a cost trends report. So they analyze lots and lots of data, and they talk about where they think healthcare costs are growing and which areas. And then in response to that, they hold public hearings where they bring healthcare industry representatives in to talk about those certain areas where they think there is excessive cost growth and what kind of strategies those entities can use to bring down that healthcare cost growth. So there is a transparency component there as well, where there's very upfront discussion about how we can do a better job in bringing healthcare costs down.
And it works.
And it works. As I said, the $5.5 billion is pretty good evidence of cost avoidance.
How receptive is the insurance industry to this? I mean, I'm still trying to figure out what this exactly translates to, but how receptive are they? I mean, if the costs really are their issue, how willing are they to come to the table and negotiate and drop costs?
It's not just about the insurers. It's about everybody in healthcare, and it's setting a really strong benchmark goal that everyone has to adhere to, whether they're a drug company, a hospital, a insurance company. Everybody's got to be on the same page because, one, just doing it separately doesn't work. You have to do it globally, and that's what this is all about, setting a global benchmark that everyone has to adhere to and will be held accountable to based on that process that Vicki just elaborated that happens in Massachusetts. Once we see what's happening with the total picture, it will help, as the governor said, inform what we can do on a case-by-case scenario to lower the costs.
So you all kind of agree on certain costs and certain prices and where you can improve and lower and...
And one of the things you find always, whenever you have a conversation about healthcare, is you get a lot of finger pointing, right? You see folks blaming the drug companies, and then the drug companies blame the hospitals, and the hospitals blame the insurance companies. Everybody blames each other. What this is doing is it gets everybody at the same table so we can actually figure out where the real cost drivers are and what can we do about them. Are there things that we can do to help address that? And I think what you'll hear from industry is that they welcome that, because you no longer get this case of beating up on one industry or another. You're really focusing on the overall healthcare system.
Christine?
So the executive order allows for Vicki and her office to analyze this data by December 2022. Do you also need legislation then I guess, implement this?
So, right, the executive order essentially requires us to develop the first benchmark by the end of this year, actually, to go into effect next year. And 2022 would be the year we looked back on 2021. There is a need for some legislation in terms of protecting certain kinds of data that will be produced to the Office of Health Strategy. Certain sensitive proprietary data that would otherwise not be subject, let's say, to the Freedom of Information Act. There needs to be protection for that, as we already have in some of our existing laws. So we're collecting more data than we already have. So we need to protect certain data streams there.
And this would be across practices, so this would be more than primary care. It would be all...
It's across all healthcare entities, yes.
So when you say benchmarks, do you mean benchmark or benchmarks plural? For example, you're going to determine that an annual physical should cost no more than $200 anywhere, and everybody has to charge that?
No. So what the order does is establishes a statewide annual health care cost growth benchmark. So that's a cost growth benchmark. So it's a percentage by which we think healthcare costs can grow at an acceptable rate, and that's overall. So it's a per capita average annual cost growth benchmark, which is a mouthful.
But it's not going to stop.
It's not. We're not going. And it's when we say benchmarks. The reason we say benchmarks is because every year you need a benchmark.
What happens if in the middle of the year there's a spike in the cost of energy or some other thing you weren't anticipating? I mean, all of these providers have to deal with that just like people who have to heat their homes.
And that's absolutely right. And we would be talking to providers about that. The purpose is not to penalize people. The purpose is to work together on strategies to bring down the cost of healthcare and improve the quality. So if you look to the other states that have been doing this, they're not dropping hammers down on people who may exceed the benchmark. And of course, if there is a public health crisis or there's something else like that that affects everybody as a whole, we definitely would be looking at that and factoring that into the work.
So there's no penalty. There's no penalty for not meeting a benchmark.
At this point, what we would be looking to is the Massachusetts model, which has what we call performance improvement plans. So if an entity were to exceed the benchmark, the annual benchmark, They would have confidential discussions with the Office of Health Strategy about how they could bring those costs under control. And frankly, they haven't needed the penalty. It's worked. So they haven't even had to use the performance improvement plans because of having the target. There's a pressure there to keep those costs under the benchmark.
Now, the hospitals are a big factor here. Did the recent hospital settlement have something to do with coming to this conclusion that you could sign this executive order? Did they say, did this stuff ever come up during those negotiations?
Well, working with my friends here, the hospital settlement certainly is part of the new collaboration we have, working with our hospitals, working with the PBMs, working with insurers, working all rowing in the same direction. To your question, the insurers welcome this. Because they get blamed for a lot of the underlying costs of healthcare as they go up. So what we're doing now with this transparency, what we're doing by showing what these benchmarks are, what we're doing is showing how you comparing costs to elsewhere, gives us leverage, gives them leverage as we try and negotiate prices going forward. It wasn't done with a hammer, as Vicki said. It wasn't done with penalties, but just the sunshine lit on that in Massachusetts has given us a lot more leverage as we figure out what prices are appropriate, and that has slowed down the rate of increase dramatically in Massachusetts. We hope to do the same right here.
So it came from your close pal, Charlie Baker, all this collaborative meetings that you had with the other governors?
To tell you the truth, it did to some degree. I mean, Charlie Baker comes out of the healthcare space. He was previously in healthcare in previous governments there. We've looked long and hard at what he's been able to accomplish there over the last 5 years with the benchmark, and we'd like to be able to accomplish the same thing here.
So when would you like to bring down the cost by 20%? Do you have a year or a date by which you'd like to do that? You said your goal was to bring down the cost by 20%.
That's a different issue.
Different issue.
Okay.
And you also said the primary care, if I heard you right, primary care in the future was going to be 10%. What is the number now? You mentioned the future.
Back here.
I'm way back here.
Hi, Chris. Hi, Chris. I'm sorry I couldn't see you.
I'm the guy who needs health care in the back.
Maybe I can't even see over the mics, even though they've been lowered. No, okay. Right now, depending on what research you look at, there was a recent study done by the Patient-Centered Primary Care Collaborative, which showed that Connecticut overall, not including Medicaid, which actually spends more than the other payers, spends less than 5% of total health care dollars on primary care. We think we should get to 10.
Okay.
Anybody else?
Thank you, everybody.
Thank you.